Dear students, welcome back. In the previous session we have discussed about femur. Now in this session we are going to discuss about patella. Patella is the largest sesamoid bone in the body. Okay, here the patella, the word again derived from Latin and it is called a small plate-like. Okay, and it is developed in the tendon of quadriceps femoris in front of the knee joint. It is triangular in shape and it is flattened from before backwards. And it is situated in front of the lower end of the femur about 1 centimeter above the knee joint. So that is the location of the patella. Now if you can see the determination of side, the patella is triangular in shape, so and it is having a base and the apex. Okay, the apex is directed downwards and apex is non-articular posteriorly. So here in the this one is anterior aspect and this one is posterior aspect. On the posterior aspect, which is non-articular. Okay. Next, the anterior surface is rough and here it is non-articular. The upper 3/4 of the posterior surface, the upper 3/4 surface on the posterior surface are smooth and articular. So here on the anterior aspect you can find some irregular areas for the attachment of muscles. So that means the anterior surface is rough, and in the posterior surface if you can see upper 3/4 it is smooth and it is also articular. Okay. And the posterior articular surface is divided into two areas by a vertical ridge. So here you can find the vertical ridge. So in this vertical ridge, it is divided into a larger lateral area. Okay, larger lateral area this side and smaller medial area. So by this we can identify the side because we can find the lateral side, isn't it? So if the bone laid on the table rests on the broad lateral articular area and determines the side of the bone. Okay. For example, on the table if you can keep the patella, so the lateral aspect, will lay down on this side. So that means on the anterior, this one is anterior aspect and the lateral aspect will lay down this side. This and also the pointed end which is faced inferiorly, and the anterior surface is rough and the lateral side of the posterior aspect will laid on the floor. By seeing these things we can identify the bone. Okay, simply we can how can you determine means the pointed apex lies inferiorly, anterior surface is rough, lateral surface on the posterior aspect is larger and deeper than the medial facet. So by these three features we can identify the side of the patella. Okay, now we'll see the features of the patella now. The patella has an apex. Okay, it is having 3 borders and 2 surfaces. So the patella is having an apex. So already we know that this is the apex, and it is having 3 borders. So what are the borders? So it is having medial border, lateral border and the superior border. 3 borders, and two surfaces. One is the anterior surface and another one is the posterior surface. So these are the features. So the patella is having an apex, okay, and it is having three borders. What are those? So medial, lateral and superior, and two surfaces, anterior surface and posterior surface. So these are the features of patella. Now we will see one by one. So the apex is directed downwards, okay, which is rough and vertically ridged. It is covered by an expansion from the tendon of the rectus femoris, and so this part, only this part, and this part is separated from the skin by prepatellar bursa. So a bursa is present in front of the apex, which is separating from the skin, okay, and that vertically ridged apex is covered by an expansion from the tendon of rectus femoris. So it is covered, only it is covered by the expansion of the tendon of the rectus femoris. Okay. Now on the posterior aspect, normally it gives it is having an area which gives an attachment to the ligamentum patellae. Okay. So we will see in the attachments of the attachments of the patella. Okay. Now we will see the posterior aspect, which is very interesting actually. So here we can see the posterior aspect here. This side is medial, okay, and lateral. You can follow this box for the sides. So medial, lateral, superior and inferior. So how this posterior surface looks like. Okay, so I have already mentioned that in the posterior aspect, the patella is divided into two facets. One is a larger lateral facet and medial smaller facet when compared to the lateral facet by an vertical ridge. And again this medial facet is going to divide into another two parts. So this is in the medial side. A vertical ridge separates this into a medial strip from the medial portion. Okay, so this ridge separates a small amount of medial strip from the medial portion. So actually this strip articulates with the reciprocal strip on the medial side of the intercondylar notch of the femur. So you know that intercondylar notch, isn't it? On the posterior aspect, you can find this intercondylar notch like this. So it will articulate with the medial aspect. The strip is going to articulate with the medial aspect of the intercondylar notch. Okay. That too during full flexion. During full flexion, these two will go articulate with each other. Okay. The rest of the medial portion, here the rest of the medial portion and the lateral portion of the articular surface are divided by two transverse lines into three pairs of facets. So again this is going to divide into two transverse planes, by the two transverse planes, into three pairs of articular facets. Okay, so how these facets are going to articulate in different phases of movements of the knee, now we will see. So these the lowermost we can call it as first pair, and the middle we can call it as second pair, and the uppermost part we can call it as a third pair. So during different phases of movements of knee, different portions of the patella articulate with the femur. The lower pair, that is the first pair, articulates during extension. During knee extension, these two will articulate with the femoral condyles. And then next one, the middle pair will articulate at the beginning of the flexion. Okay, and the upper pair during mid flexion, and this medial strip during full flexion of the knee. So these are the facets of the patella which will articulate with the femur in different phases of movements of the knee. Okay, now we will move on to the attachments on the patella. Okay, so now we will see the superior border. So normally the superior border is thick. It gives attachment to the part of the quadriceps femoris which is derived from rectus femoris and vastus intermedius. So this is the superior border. So this will give attachment to the rectus femoris and vastus intermedius. And if you see the medial and lateral borders, gives attachment to the vastus medialis on the medial aspect and vastus lateralis on the lateral borders. Okay, a small shallow circular depression near the junction of the base, okay, near the junction of the base and the lateral border gives insertion to the vastus lateralis. Okay, now the apex gives attachment to the ligamentum patellae. So here you can see, so this is the ligamentum patellae is getting attached on the posterior aspect of the patella. Okay, so these are the attachments of the patella. Now we will see the ossification. So this ossification of this patella will have several centers which appears during 3 to 6 years of age, and the fusion is complete at puberty. 1 or 2 centers at the superolateral aspects, superolateral angle of the patella may form separate pieces of bone, so you can see separate pieces of bone. Such a patella is known as bipartite patella or tripartite patella. Okay, the condition is bilateral and symmetrical. If you see some of the applied anatomy, there is a natural tendency for lateral dislocation of patella because of the outward angulation between the long axis of thigh and leg, and this is prevented by a bony factor, that is the lateral patellar articular surface is larger and deeper than the medial one, and a muscular factor, that is lower fibers of vastus medialis run laterally and extends to a lower level for insertion to the medial border of the patella. So these are all about the osteology of patella. In the next session we are going to discuss about another long bone called tibia. Thank you.